everyone, I am Andre, your swine suit nurse for the day, and today I am going to perform and demonstrate the evaluation checklist performing perineal care, catheterizing both male and female urinary bladder using an indwelling polycatheter. The first thing we need to do is we're going to assemble all our equipment and supplies, such as a polycatheter, urine bag, antiseptic solution, lubricant, a syringe filled with sterile water, forceps, sterile gloves, and of course cotton balls, and all other equipments that we're going to use. After that, we're going to explain the purpose and procedure to our client. Uh, the insertion or the introduce of polycatheter is to relieve from discomfort and pain, to provide continuous drainage of the bladder, to provide continuous irrigation of the bladder, and to collect sterile urine sample. After that, we're going to explain also any allergies, especially from iodine and latex. And after that, we're going to provide lights. We're going to use an artificial light, such as flashlight or fairy light. And here we need an assistant for holding and position. After that, we're going to perform hand hygiene again. And after that, we're going to provide for our client's privacy by closing the door and drawing the curtain in the room. And we're going to position our client. For female, we're going to position the male client on a dorsal recumbent position with her 2 feet apart and with her knee flexed. After that, we're going to position the male on a supine position with his leg a little abducted. After that, we're going to clean the client's genital area using a warm water and soap and rinse and dry well. And of course, we're going to perform hand washing again after. After that, we're going to open the sterile catheterization tray on a clean over tail using sterile technique. After that, we're going to put on our gloves. After that, we're going to place a fenestrated sterile drape over the perineal area and drape above the patient's thigh. After that, we're going to place a sterile tray in drape between patient's thigh. After that, we need to open all our supplies. If we're going to use an indwelling polycatheter, we need to test the balloon of the catheter. So we're going to use a syringe filled with sterile water. We're going to remove the tip of the syringe. And we're going to attach the tip of the syringe on the injection port. First, open the urinary catheter. And attach the syringe to the injection port. After that, we're going to inject some water. So as you can see, the balloon is working. And then, the balloon is working. After that, we're going to withdraw the water. And we're going to leave the injection attached with the port. After that, we're going to pour an antiseptic solution on our cotton balls. The cotton balls. And here is the antiseptic solution. So we're going to pour a little amount. After that, we're going to open the urine container if there is to be drained. After that, we're going to lubricate the tip of the urinary catheter, of course, with a lubricant, 1 to 2 inches of the tip. We're going to place a sterile grip over the client's genital area on the client's top of the thigh. After that, using our thumb and other fingers, we're going of our non-dominant hand, we're going to spread the labia and identify the meatus. After that, using our forceps and cotton balls, we're going to clean the meat. We're going to clean the perineum using a with disinfectant. We're going to start from the meatus down to the rectum. After that, we're now going to insert the Foley catheter into the meatus from 7 to 7.5 or 2 to 3 inches or until the urine flows. We're not going to use any forceps here in pushing the urinary catheter, but instead we're going to ask the client to breathe deeply, and we're going to insert the catheter in a slowly rotating manner. And after that, for an indwelling Foley catheter, once the urine drains and the advanced catheter, another 2.5 to 5.0 or 1 to 2 inches. Ma'am, please deeply. Inhale, exhale. Inhale, exhale, inhale, exhale, inhale, exhale. Hindi po. When introducing a Foley catheter to a male patient, we're going to lift the penis with our non-dominant hand, which is now then considered contaminated or unsterile. After that, if the patient is uncircumcised, we're going to retract the foreskin. After that, we're going to clean the area using a cotton balls with antiseptic solution held by the forceps. After that, we're going to clean using a circular motion, starting from the meatus to the top of the penis. We're going to cleanse in 3 consecutive times. Three. After that, we're going to hold the penis again and slightly upward tension to perpendicular to the patient's body. Gently insert the tip of the syringe with lubricant into the urethra and instill 10 ml of lubricant into the urethra. And after that, we're going to insert the tip into the meatus, the tip of the polycatheter, and then advance an intermittent catheter to 15 to 20 centimeter or 6 to 8 inches. After that, we're not going to use the forceps to introduce the catheter. If the catheter resists to the um, enter, we're going to ask the patient to breathe, and we're going to defluviate the catheter slightly. Sir, please inhale, exhale. Huminga po tayo ng malalay. Exhale po. Inhale, exhale. Inhale, exhale. Thank you, sir. And we're going to wait until the urine flows. For both male and female, if catheter to be used is in welling, inflate the balloon according to the manufacturer recommendation, 5 ml or 5 cc. Towel gently on the catheter after the balloon inflated, or to feel resistant. Secure to upper thigh with a Velcro straps or tape, and leave some slack in the catheter to allow for leg movement. We're going to check where the drainage tubing is not kink, and a movement of the side rails does not interfere with catheter or drainage bag. We're going to hang the catheter below the bed of the bed. After that, we're going to remove all the equipment and make the patient comfortable in bed. So we're going to help the client to place on a comfortable position on the bed, and we're going to clean and dry the client's perineal area, and we're going to care for the equipment according to the agency policy. After that, we're going to perform hand hygiene, and we're going to record the time of the catheterization and the amount of urine movement, description of urine, and patient reactions to procedure.